Good afternoon, everyone. I would like to thank CDH International for inviting me to present on the 2021 Global Congenital Diaphragmatic Hernia Conference. Unfortunately, we can't be meeting in person, but I'm honored to be presenting some of our research today. My name is Richard Keijzer. I'm a pediatric surgeon scientist at the University of Manitoba in Winnipeg, Manitoba in Canada. And the title of my presentation is going to be Miracles for Babies with Abnormal Lung Development and Congenital Diaphragmatic Hernia. I come to you from Treaty 1 territory, the traditional lands of the Anishinaabe, Cree, Oji Cree, Dakota, and Dani peoples, and the homeland of the Métis Nation. I have a conflict of interest to disclose. I hold a patent for some of the technology that's described in this presentation, and have also filed for a patent to use circular RNAs as biomarkers for abnormal lung development and congenital diaphragmatic hernia. When we're doing our research, I always like to ask why we're doing certain things and why certain things happen. And that is inspiring me to keep doing research into the development of congenital diaphragmatic hernia and the associated abnormal lung development. My main inspiration, though, is patients like this. This is Kara Ham. She was born with congenital diaphragmatic hernia in Winnipeg. I was called to the intensive care unit and we operated on her after she was stabilized. But then she spends weeks in the intensive care unit struggling from her abnormal lung development. And it is patients like Kara that help me stay passionate about trying to understand why congenital diaphragmatic hernia develops. The harsh reality is that since the year 2000, over 425,000 children born with congenital diaphragmatic hernia have died throughout the world. And this is way too many to accept, and that's why I feel very strongly that we need to do more research toward what is causing congenital diaphragmatic hernia. In my mind, the main problem is the abnormal lung development. As surgeons, we can close the hole in the diaphragm, but it is because of the abnormal lung development that these patients end up in the intensive care unit around their surgery and after we perform the surgery. So this is where my research program comes in. We called it MIRACLA, and it stands for microRNAs and congenital lung anomalies. The question that we're trying to answer in our research is what is wrong with congenital diaphragmatic hernia lungs? And if we understand that better, are we able to improve the lungs before birth so they don't have as many breathing problems after birth when babies with congenital diaphragmatic hernia are born? There is a treatment that helps babies grow their lungs before birth, and it's called FETO. And you're all probably aware about this balloon treatment that doctors can put into the windpipe of babies that are in utero still, developing, and the balloon then causes the lungs to grow and improve. When we did a study on the overall effects of this, we found that most babies that undergo this treatment were having better survival after they were born. However, there are significant negative side effects of this treatment. It's a fairly minimal procedure, but at the same time, babies can be born prematurely and there can be other associated negative side effects. So this is where our studies come in. We started to study, when I started my research program in 2010, the role of certain pieces of genetic code called microRNAs that can influence gene expression. So normal genes make a type of RNA, and that can then be developed into a protein, and the protein has roles in your body. MicroRNAs function like light dimmer switches. So instead of just turning on and off, which a normal gene would do, these microRNAs regulate the gene expression. So in 2015, we were the first to discover that certain microRNAs are having different expression when we checked the microRNA levels in control lungs and in congenital diaphragmatic hernia lungs. The levels of MIR200B were much higher in lungs from babies with congenital diaphragmatic hernia. We then collaborated with Dr. Deprest from Belgium, who was organizing a trial on the FETO treatment, and when we looked in the lung fluid of babies that were undergoing this balloon treatment, we found that when the balloon was put in place, the lung fluid did not show any differences. However, when the balloon was removed, we found that MIR200B was much higher in the lung fluid of babies that would eventually survive the treatment with the balloon and after birth when they were born with congenital diaphragmatic hernia. When we started our research, we looked into the literature and found that the main role known for MIR200B was in the interplay between epithelial cells and fibroblast or mesenchymal cells. And the role was mainly known from cancer cells, where this back and forth between epithelial cells and mesenchymal cells plays an important role. We then created a mouse that didn't have MIR200B, and that would help us to study how mice develop if they don't have MIR200B. And what we found is that these mice develop normally, were born with fairly normal looking lungs, and they didn't have a hole in their diaphragm. However, when we looked more carefully, after they had grown to young adults, when we measured their lung function, we found that the abnormalities observed in these mice lungs were similar to what we see when we do lung function studies in children that have survived congenital diaphragmatic hernia. So when we started to look more carefully in these lungs, we made slices of the lungs, and on the left of the screen you see a normal lung, a control lung, and you can imagine that these little walls are much thinner than the walls, the airway walls, the alveolar walls of the mice that were lacking these microRNAs. So this demonstrated that these lungs might have difficulty exchanging gas, like we observed in the lung function studies. When we look more carefully, we found with a marker in red here that they had much more mesenchymal cells, because when we stain the lungs for phygmentin, here in red, which is a marker for the fibroblast and the mesenchymal cells, that's what's causing the thickness of these alveolar walls that is preventing the lungs from being flexible and having good air change. We also looked at their hearts, and we looked at if they had abnormal vessel walls in the lungs, like a lot of children with congenital diaphragmatic hernia have. And indeed, we found that these mice that do not have MIR200B have pulmonary hypertension. They have much thicker airway wall, arterial walls, lung vessel walls in their lungs, and that is what's causing the abnormal lung pressures in the lung. So after we had studied this in the mice, we went to another animal model, which is using nitrophen. And most people probably are familiar with the model. This is a model where we can treat mother rats that are pregnant with a compound called nitrophen. And when we do that, 80% of the offspring will have a congenital diaphragmatic hernia, and 100% will have abnormally developed lungs. When we look carefully at where microRNA miR200B was expressed, we found that in the control lungs it was highly expressed, shown by the dark blue staining here. But when we looked at the lungs that were treated with the nitrophen, we found that they had much less blue staining, indicating that they had lower levels of miR200B. When we measured that with a different technique, we found that the lungs that were controlled had a certain level. The lungs that were abnormally developed after nitrophen but did not have a hole in the diaphragm were similar to control, but the lungs that were taken from rats that had a hole in the diaphragm had much higher levels of miR200B. When we treated cells, human cells, with nitrophen, we found that the levels of miR200B were going down. When we measured certain factors that are known to be regulated by miR200B, we found that if we blocked miR200B with an inhibitor, we saw the levels of these genes go up. When we lowered miR200B with nitrophen, the levels of these genes were going up. But if we give nitrophen and then give miR200B at the same time, the cells were looking normal again. What we found is, again with this red stain, that if we lower the levels of miR200B, we see an increase of the red cells, indicating that these cells are not epithelial, which is required for good lungs, but they are more like a fibroblast. They are more fibrotic. They are more scar tissue-like, and that's what's causing these lung function abnormalities. When we look more carefully at where miR200B was expressed, we found these dark blue dots in the lungs. And when we looked at the next section, we found that this is a piece of airway that's growing in development. So we found the highest level of expression in airways that were growing during development. So this to us indicated that maybe there is a function for miR200B in the growth of the airway tips. So we could test that by putting lungs in culture, and we know that if we put them in culture, that they will start to branch. They'll make little branches in culture, like they would do when they're developing in an embryo. When we block miR200B in these lungs, we found that there is much less of this branching. So when we calculated that, we saw lower levels of branches in these lung explants. If we treat lungs with nitrophen and put them in culture, but then give miR200B back, we saw that the lungs were much more normal looking and had normal amounts of branches. So then we did a very interesting experiment. We treated the mother rats with the nitrophen, and we know that a lot of the offspring will then have abnormal lung development and holes in their diaphragm, and typically they would not survive after birth. We know that, so that's why we always euthanize these rats for our studies before they are born. However, we were allowed by a committee that reviewed this to check if babies, after we treat them with the microRNAs, when they were still in the uterus of the mother rat if they would develop better lungs. And to our surprise, that's what we found. At the top, you see a rat fetus that looks really pink, nicely developed, and very lively. This is a rat that was treated in the mother with nitrophen, but at the same time, we gave MIR200B back, and that resulted in a much more lively pup when they were born. The ones that were not treated with MIR200B and only treated with nitrophen were having much less good outcomes. We found that the incidence of holes in the diaphragm reduced from about 65% to only 25%. And when we looked at the lungs again, this is a lung that was treated with nitrophen, and you can appreciate the thick airway walls again, making the lungs much more stiff. However, when we treated these fetuses with microRNA MIR200B, the airway walls were much thinner again and much more functional. And when we used certain measurements to measure if these lungs were abnormal, indeed we showed that when the MIR200B was added as a prenatal treatment, the lungs were much better. So this is what we think is going on in lung development. On the left of the screen, you see a normal lung when it's in development. You need a certain balance between epithelial cells and fibroblast cells, the scar type like cells, to allow for the lungs to have efficient gas exchange. And you need more epithelial cells than fibroblasts. This will help children when they are born to have normal ventilation and normal exchange of oxygen to the bloodstream. In a congenital diaphragmatic hernia lung, the levels of microRNA MIR200B are much lower, and this shifts the balance to more fibroblast, which then results in a much stiffer lung and in a lung that is much less effective in doing gas exchange between the environment and the bloodstream. So ventilation is much more difficult in these lungs. So this is our overall framework, what we work with to develop our research program further. We think we need to better understand how the lungs develop abnormally within congenital diaphragmatic hernia. We need better biomarkers to have a better idea of the prenatal diagnosis. Then we can think about how we can start developing treatments that will help improve the lungs before the baby with congenital diaphragmatic hernia is born. Now I will spend the last part of my talk on some research that we have done into biomarkers and circular RNAs. I think this is where circular RNAs can play a role. So I've talked a little bit about microRNAs, which are pieces of genetic code that are linear. However, these microRNAs can be regulated by circular RNAs that function like a microRNA sponge. We know, and we've recently learned, that circular RNAs are kind of the perfect biomarkers. They're very stable, they're very specific in their expression, and they have high abundance in blood, in amniotic fluid, and in other compartments of the body. When we checked in lungs from nitrophen and control rats, we learned that there is a very specific circular RNA profile, which is dysregulated in the hypoplastic lungs. We then collaborated again with Dr. Deprest, and we checked in the lungs of babies with congenital diaphragmatic hernia and control lungs to see if we could find differences in these circular RNAs there as well. And indeed, we found that there's very specific circular RNAs in the middle of pregnancies in these lungs, and there's also very specific circular RNAs at the end of pregnancy. And at the bottom, you could see that these patterns are completely separated from each other, indicating that based on the circular RNAs, we could identify what was a congenital diaphragmatic hernia lung and what was a control lung. We then worked together with Dr. Deprest again, and we had amniotic fluid samples from patients that were about to undergo the balloon treatment again. Based on the imaging parameters of these patients, they were completely similar. So based on what we can now do for prenatal imaging and prenatal diagnosis, they looked completely the same. So finally, I would like to thank patients like in the audience today and patients like Kara that we can work together to try and improve the understanding of abnormal lung development in congenital diaphragmatic hernia. Congenital diaphragmatic hernia is occurring as frequently almost as cystic fibrosis. However, it has been understudied, and therefore we don't really understand well why these lungs develop abnormal and why babies can have a hole in their diaphragm during development. And I think as researchers, we need to play an important role in learning from patients like Kara and making sure that future patients with congenital diaphragmatic hernia and the associated abnormal lung development have better outcomes and do better later in life. I would like to thank the members of my laboratory. This was 2 years ago during a flag raising ceremony to create awareness for congenital diaphragmatic hernia in Winnipeg. And the person with the red arrow next to his head is the mayor of Winnipeg. He's not part of my lab, but he was there when we raised the flag to create more awareness for congenital diaphragmatic hernia. I'd like to thank the members of my laboratory and the collaborators that have helped me do the work that I presented to you. And finally, I would like to thank the funders of the research. Thank you very much, and I would now join the panel to answer any questions that you might have.